Hello, everyone. I'm thrilled to be discussing with you today the results of the phase 3 HARMOni-6 clinical trial. Now, we've all become familiar with the paradigm in non-small cell lung cancer, the use of chemotherapy with checkpoint inhibition. In this particular study, the control arm of chemotherapy plus tislelizumab was used as control. Again, that's a PD-1 inhibitor, and compared against the therapy that I think is quite exciting, ivonescimab. Ivonescimab, for those that aren't familiar, is a dual VEGF PD-1 inhibitor. And again, the mechanism here is complex. It really seems to sort of amalgamate and really accentuate the response that we might expect with either VEGF inhibitor or checkpoint inhibitor alone. Now, what we see in the context of the HARMOni-6 study is a randomization of patients, and in total about 532 between the regimen of chemotherapy plus tislelizumab versus chemotherapy plus ivonescimab. And the results here, I think, are quite astounding. What we see here is an improvement in median overall survival. The median overall survival with ivonescimab with chemotherapy was 27.9 months. That with chemotherapy and tislelizumab was 23.7 months. And in addition to this, we saw that that benefit in overall survival is fairly consistent across subgroups. With that in mind, I think that we might actually be looking towards ivonescimab and this class of drugs, which again entails that combination of VEGF and PD-1 inhibition in the frontline setting in non-small cell lung cancer in certain markets. Of course, it remains to be seen, how this data is going to pan out in the US. I think that this is really exciting data and looking forward to seeing its further development.